Pay a fixed monthly amount, which is called a premium, as part of the contract. And insurance plans can be purchased through marketplaces like the Health Connector or from private insurance companies, online insurance sellers, or agents and brokers. There are many kinds of private health insurance, as you know, health insurance plans that offer very different kinds of benefits and access to different providers. And when consumers have health insurance, they pay some costs and the insurance company pays some costs. The different costs associated with health insurance and the way that the costs are split between the consumers and the company will be explained later in this course. So this is some information on this slide that could be useful to you when you're explaining to other people. If you already do so, well, you've got it as a resource. So why is health insurance important? Well, I think we all know why. It offers preventive healthcare services to help consumers stay healthy. And most insurance plans must cover many preventive services free of charge under the ACA, as most of you already know. Health insurance also helps consumers pay for healthcare services if they become sick or injured. Without health insurance, costs for health services, as you know, can be extremely high and can result in serious financial hardship, as we've talked about before. So both the ACA and Massachusetts state law requires consumers to have health insurance, or they pay a penalty unless they qualify for an exemption. And again, we've talked about this before as well. To make sure that health insurance people are required to obtain coverage what they need. Boy, that sounded really strange. Sorry. To make sure health insurance people are required to obtain coverage of what they need, most health insurance plans are required to cover a core set of what are the EHBs, or the essential health benefits, because of the ACA. And again, we covered this also in the previous training. So continuing on, one of the key components to ensuring the uninsured is increasing health insurance literacy. Right? For many, the first step toward getting coverage can be understanding the value of health insurance. Again, I know a lot of you already do this, but this is, again, something that, if you don't already, these could be important materials that you can take and then repurpose for your prospective communities. So major benefits to having health insurance include having access to day-to-day, the immediate, everyday care, primary and specialties, the day-to-day routine, emergency and follow-up care, preventative care and chronic disease management, protection from financial exposure when someone is sick or hurt. And the essential health benefits are one way that the ACA ensures that coverage most consumers